I went through ultrasound school while in the Navy Reserves, and from that point on, worked at UC San Diego at the Trauma Center, where I got most of my postgraduate training. And here, I've been in the Bay Area ever since, working as technical director at Good Samaritan Hospital for 13 years, and the technical director at the Vascular Associates, which is an outpatient center here in Los Gatos. And now the freestanding, I'm the technical director here at the Institute for Vascular Testing. Well, I've been doing this 23 years, and I started off as a vascular technologist, and then I was in a lab that combined with a diagnostic ultrasound lab. And within that, I was trained to do general ultrasound, and I trained them to do vascular technology. And that was actually in a trauma center. But what happens in an acute situation like that, even though your technologists are trained, what in a hospital, in an acute care facility, what takes front and center are the traumas, are the surgeries, are the people who need to go to surgery right away, which is the right thing to do. But you have somebody who has had a chronic problem, usually gets put on the back burner, or limited exams are performed. And that's what happens in any hospital. You know, there are acute care, there are very sick patients, they do need their testing first. But also when you have a very sick patient or chronic problem, most hospitals do just the acute problem, like if they have a swollen leg, wounds, diabetic issues. They mainly just rule out the acute problem so they can get treated while in the hospital. Not many inpatient facilities will do check for varicose veins, venous insufficiency, arterial insufficiency, with the wound while they're there, because basically wounds are a chronic problem. So the patient usually ends up going through 2 or 3 or 4 different tests. And how we got to this point, over the years, a lot of vascular surgeons have opened up exams in their office, have gotten ultrasound machines to where one of us technologists will come over and we will provide that type of comprehensive testing for their patients while they're following up with the physician. That happens all over the community, all over the United States. But we wanted to go one step further and provide the outpatient testing center that's fully staffed, including evenings and hopefully weekends, with a panel of diagnostic readers. So we can still provide that service independent of the vascular surgeon, independent of them, independent of their practice. So if the patient has a vascular surgeon, say in Palo Alto or elsewhere, they can take their interpretation with them. So we wanted to go one step further and provide the comprehensive testing in an outpatient setting.